Very good evening to everyone. We are here with yet another session. Today we are here with Dr. Shreya Pujari. She has completed her BNYS from SDM, College of Naturopathy and Yogic Sciences. She has done post-graduation course in acupuncture and moxibustion from Indian Research Institute of Integrated Medicine. She is working in Mumbai renowned holistic center Reset Life India since 3 years as a subject matter expert in yoga and content acquisition manager. She's also doing freelancing in acupuncture, yoga, nutrition since 3 years. And she is having own work and she is founder of the Ojas Yoga. So with this small introduction, I would like to welcome you on our platform on your growth. Thank you so much.
Thank you, Dr. Bhavin. Thank you, Own Your Growth organization, for having me here today. Namaste to all the viewers and the audience we have. And I'm Dr. Shreya Pujari. I am a BNY's doctor and I've done my post-graduation certificate course in acupuncture and moxibustion, as Dr. Bhavit rightly said. So basically today, I'm going to talk about how important is networking and building confidence in BNYS students. And all these students actually, not only BNYS, but in every field, whichever field you go today, you require good communication skills, you require proper networking skills with you, and confidence is the key. So this is basically to guide the students and people who lack confidence. It can be due to n number of reasons and factors. Sometimes it's associated with some post-traumatic situation or some conditioning, or something in your mind that struck you, that you're not being able to speak up, you're not being able to express yourself properly. But that's how you have adapted, and that's how you have to get out of this chain of not being able to express, from being able to express yourself in a right and in a very comfortable, clean manner. Sometimes people are over expressive. That is also not that good, but you have to be expressive in a way where you connect to the audience, where you connect to your patient, until and unless you connect to your patient, client, or user, or anything. Now, I work in a corporate setup, in an IT setup. When I started this journey in Reset Tech, first I was in Reset Life. Basically, in Reset altogether, I have almost 3 years of experience. But earlier, I was in Reset Life, and there I was working as a nutritionist and yoga therapist. Then I joined in Reset Bangalore. Then I switched to Reset Tech. Now, in Reset Tech, we are trying to build an app called Ayu. So it is all about the user basis. So everything has to be with respect to user experience and everything. And not even in corporate setup, but even in your own clinic setup, or if you're working in hospital, unless you connect to the people you're meeting, unless you're connecting with the patient, they won't be able to relate with you. And that's when that connection is not there. They won't open up to you in the way they should be opening up. And unless they open up to you properly, you won't get a proper history of theirs. And then you know how important case history taking is in any doctor's life. So basically, confidence comes with your knowledge, with your personality, with the way you speak. Now, when I say the way you speak, doesn't mean that, I have to be amazing in English, or, I have to be very fluent in my language. It's not necessary. When I was in Ujjire, there were many people who would talk Kannada only, who could talk Malayalam only, or Telugu, or many South Indian languages. I, being from Mumbai, although I'm a Mangalorean South Indian, but I know Tulu. I used to not being able to connect with Karnataka patients or Hyderabad, or, such places. The languages are different. But still, somehow I learned the art of connecting not only through language, but through emotions. You need to understand that what does the patient require. Sometimes the only thing they require is someone to listen, not to talk, but to just listen. You have to understand the language of emotion. Okay, so whenever you're taking history or whenever you're talking to a patient, try to connect to them emotionally. Like, first question shouldn't be, what is your problem or what is your chief complaint? No. First question is asking their name, asking from where they are, and how did they come to the place where you are situated, or how do you get to know about me, the sir or ma'am, or the patient's name. You need to connect to them on an emotional level. Did you have food? Is the pain terrible, or how are you managing it? How are you doing today? How was your day? You have to ask such questions that comforts them first. Ask something about them first, not about only their condition, but about them, their life. What do they do? So they understand, okay, this person is ready to listen to me. Okay, now I can open up to this person, this doctor. So that's how important communication skill is. Sometimes I've seen doctors, they have abundance of knowledge. They've read each and every book in patho, micro. They have been done and dusted with all the pathological conditions on this planet. But still the patient is not comfortable with them, because they just, okay, this is the problem, okay, this is the symptom, okay, ye ho raha hai, okay, fine, this is the solution. That's what misses out the essence. And especially in nature cure, in yoga, ayurveda, and homeopathy, and such alternative medicine, we have to connect at a very emotional level. There's a very thin line where we need to touch, okay, of the patient, so that they open up to us, they vent out things. Now, it's not about psychological counseling session, but at least the person has to be comfortable to share what's going on within. Okay, how personal it might be, but you have to just understand and let it be. Another thing is, sometimes we are very expressive, but our vocal tone, you don't have that. Sometimes, I've seen people also who are very confident, who are very expressive, they relate, but they are in a different type of hurry, or they're very sharp in what they want to talk about. You have to be a little humble, you have to be respectful, so that the person feels happy talking to you. Not only just wants to talk to you, but feels happy, gets something out of your conversation. That's how it is. And this comes with practice. This doesn't come overnight that, okay, kal se mujhe confident banna hai, or from tomorrow I want to become confident. So I'll just, read some books, see some videos, and just go on. It doesn't come like that. Everything that you have right now needs some time to, you need some time to get out of that phase and to adapt a new thing in your life or in your habits. So then it comes to learning some skills of conversations, talking to your own people first, your own family members with whom you're comfortable, and how you talk to them. Take honest feedbacks from your cousins, from your family members, from your friends, on how was the conversation, how are you feeling after it, or some new patients, your family friends maybe. You need to take honest feedbacks on how was the session, how was the case history taking, how did you feel talking to me honestly. You need to do that. And over, after some times, after like 3-4 sessions like that, you will develop that skill. You won't even know when you've developed that thing, but you will get it. And next thing what I want to say, talk about is networking. Now, networking is very, very important. Sometimes we have that ego in ourselves that, I am self-sufficient. I can do everything I want. I know everything. And, I don't require anyone's help. But that's not how it is. Somewhere you require your seniors, you require juniors, you require your teachers, your friends, even family members. You never know what clicks you where. For example, with Reset. Now, being in Mumbai, I just got graduated. I just came out of my college and it was COVID. So we were all in lockdown and we didn't have any place to go, jobs to search or anything. I was just at home. That's when one of my friends friend connected to me that, listen, hey, we have a vacancy at this holistic center, that's Reset. Why don't you just try applying to that place? I said, how will I get it? I'm not even like, I don't have any experience. I just graduated barely. I don't have any experience. Why would they want me? No, the way you talk, the way you present yourself, the knowledge you have, I think you can crack it. You just try. what's the thing in trying? I said, okay, fine, let me just try. And I went there and I gave my interview and everything. That was my first ever interview, by the way. I went there, I spoke to them, and I was very inconfident at that time. My hands were shivering, because you don't have any experience prior to this. So I was just very nervous, but somehow I calmed myself down. I was like, it's just a trial, and you know what you know what you're doing, you know what it is. So just go there and just talk it out. I said, fine, let's go. And the interview went, there was first round, second round, third round, like that, 5 rounds of interview happened. And it was a gap of 20 days after my interview. There was no response. I thought maybe I've lost, I didn't make through it or whatever. Then finally I got a call and I got selected and I got this job. And trust me, it was a very good package deal. So that's how, from friends to friends, or sometimes even your relatives, even your family members, some friend where you just met them and you shared some information, they might have loved it. They will give you some connections, they will give you some break through which you might shine bright. So just you need to be confident about yourself and build this network. Some talks, some sessions on public grounds, some podcasts or something, just participate. Maybe first podcast won't go well, maybe first talk won't go that great. You have your own social media where you can test and trial, you can go live sometimes, just people connect. And there might be some 2 lines or 3 lines that you put through the conversation, through the talk, where people might connect to you, where someone might have learned something very valuable from you. That will click. And that's when you build this network, and this network helps you to get a good chance. So that's how it is. Whichever opportunity you get through which you'll get this chance to connect to many people, maybe 5, maybe 6, but those 6 are connected to other 6 or other 20 or 50, and they are connected to someone. So via network building is very important. And sometimes, even juniors or seniors in our own field, they are placed at something. Maybe, tomorrow, if that person has to go somewhere and God forbidden something happens and that person has to leave, and they ask that person to replace, and okay, Shreya Didi, or Shreya was good at this, they'll refer you and you can get a break. So you never know what clicks where. So I'm just requesting all of you to start building networks in your own surrounding first. Give some free sessions as a beginner. If you're a beginner, give some free sessions, give some free talks, or get on public grounds, connect with people. Somewhere it will click one day and you will really thank me there. So yeah, that's how it is. Confidence, network building, and communication skills plays a very major role in your growth. As I said, people might have all the knowledge from all type of books or teachers, gold medalists, but if they are not able to convince the person in front of them, if they're not able to express what they know, that's all null and voided. You won't benefit anything out of it. So just build your communication skills, talk to people. If you think you lack confidence, talk to someone who has confidence. Build conversation, come out of your comfort zone. You cannot always be in your comfort zone. Okay, I'm not that confident, I won't talk much, I'll be in my own introvert zone. No, that's not going to help you. Somewhere you need to hustle, somewhere you need to go out, you need to express, you need to talk, you have to take embarrassments, you have to take that awkwardness. That's when you'll come out of this shell that you've created of introvert thing. The shell that you've created will break down, the resistance you have will vanish, and that's when you will gain all these 3 skills. What are they? Networking, confidence, and communication skills. So if at all you have any doubts regarding to this, or if you feel that you want to talk to someone, I'm always there on my Instagram page and Facebook pages. I'm very active on social media. You can always connect to me and talk to me. And if anything, I'll surely help you all. I would love to be there for you. So thank you. I think this was a short thing that I wanted to discuss out through this platform on Own Your Growth organization. Thank you so much, Dr. Bhavit, for reaching out and giving me this opportunity.
Thank you so much. And I would like to have 3 to 4 Q&A with you, which I
Sure,
was requesting you to
sure.
know. First is, how do you sustain yourself in this community, which
Okay.
is having so much ups and downs in terms of your academics, your research activities, your clinical expertise? So how do you sustain in this growing world? What is your point about that?
Two important words here: stand out and update. First, you have to update yourself. Keep updating. Learning never stops at any age or any phase of your life. After BNYs, the world doesn't end. You have to keep on updating. Maybe something that you're interested. Now, I was interested, super interested in acupuncture, moxibustion. I wanted to learn hammering, cupping, bloodletting, all of it. So I joined this course. I went to Kolkata. I being from a South Indian background, and comfort zone is Mumbai, stepping down to a different state all alone, and my batch was totally of boys. I was a lone girl, but still, knowledge was important to me always. And for that, I could go to any place. Even Ujjire, where I studied SDM CNYS, coming from Mumbai, it was very difficult. But again, knowledge is something that can take me anywhere. So I joined this course. So keep on updating yourself. If you like yoga, join some courses, because you always think that if you think that I know everything, that's very wrong. There are people out there who know much, much more than you in every subject, trust me. So I think there's a lot of competition outside in this world, and you need to keep on updating your skills in whichever it is. It can be nutrition. You have to keep on reading books, watch podcasts, watch videos, use social media to explore the knowledge that you already have, and build that thing in you. Second, as I said, stand out. There should be something unique in what you do. Now, only agar, everyone is doing acupuncture out there, everyone is giving nutrition consultations. Okay, everyone is giving nutrition consultations and taking yoga sessions online, offline, everything. What's that special thing that you have in you? It can be something that you tell, something that you communicate out, or some knowledge that you share in your class, or some new type of stretches or yoga practices that you know. You have to stand out and you have to update. These two things are very important to sustain yourself in today's competitive world.
And my second question would be that what was the idea behind when you started the name called Ojas Yoga? Because it means energy, which is within
Yeah,
you,
vital energy. Yeah, right.
vital energy. So, like, what was the idea behind that and how you started it?
So basically, I was in reset. Again, I was in my comfort zone. Somewhere I was getting down in my comfort zone where I had a good salary, I had good people, celebs and models and everyone around me. It was a good life. But somewhere down the line, when I see people, people used to get an image of me that, she is working in reset life or something. She's working with big people. So she might be very expensive. People stopped coming to me, the normal crowd, the normal audience that I'm talking about. So somewhere down the line, I thought that only reset won't help me to reach out to a good number of audience. Maybe I'm restricting myself to this crowd. And that's when I thought that I need to start my own thing. And that's when I started going to reset thrice a week. I used to be on a full-time job payroll. Then I told my CEO that, sir, I would want to start my own thing. And my boss asked a few questions. He had some issues with it in the early stage, but then he understood the whole idea and he said, okay, fine, you can go about it. So I go to reset thrice a week. And 3 times I started my own thing, Ojas Yoga, where vitality was the name, and it was according to the numerology and everything. A lot of intellect process took that name out. But another thing was that I would want to focus on nutrition, yoga, and acupuncture. That are 3 strengths of mine, I feel, in all the BNY subjects that I had. And to work on that strength, I started this. And then I reached out to some people. I gave them treatments at my home. This is my setup. Like, this is the living room of my house where I practice this. So people come and whole day, like Tuesday, Thursday, Saturday, I have it in my home, and Monday, Wednesday, Friday, I go to office. So 3 days when I'm not in office, morning to evening, I have patients coming in, out, taking treatments, learning yoga. I have online classes. So reaching out to many people was the idea behind Ojas Yoga. As many people as I could.
Thank you so much. It was a nice understanding from you. And my third question would be that we have a lot of insecurities about the volume of patients. We have few patients, less number of patients. And it is not about the number of patients. We should think about the how many patients we are treating and how well we are treating it. So
Right.
what would be your point of view that you would like to give to the students on that?
So basically, when you start, there's always there are many insecurities. Not only how many patients will I have or whatever it is, but you need to start somewhere, you know, and that's when you will build your confidence in your treatment also. Even if you treat two patients at first, and even if it's one, and that patient likes your treatment, gives a good feedback to you, maintaining a record of your feedbacks is very important. So you get to know that, okay, this patient got a good result. You get confidence in yourself. That patient might go and discuss this to someone else. Till date, honestly, how many ever posts might have done, how much ever testimonials I might have posted. But through Instagram, I barely got some 4, 5 people, but only to the word of mouth. Like, the communication from patient to patient, how it spreads in your locality, in your vicinity is very important. If you give good results, if you treat people with empathy and, connect to them at an emotional level, you heal them because you want to heal them and not to take money out from them. That's when it clicks, and that's when they spread your name outside that, okay, this doctor is really genuine. He really wants to listen to us, or she really wants to understand our problem and help us heal this thing. That's when you connect to them, and that's when they spread this thing about you that, there is this doctor present at this locality, this is the address, please go visit and get yourself treated. So it's just the word of mouth, which is a very important publicity that we have for ourselves. Self marketing is very important. You can use social media, you can use word of mouth publicity, but word of mouth is the best and the most genuine thing. So whomever you get, you treat well, you give your 100%, 100%, that person will give his 100% to get people out for you. So first, not thinking about the monetary aspect, about healing aspect, being focused and showing empathy and love for that patient is very important. That's when we'll click.
My last question would be that how do you deal with your challenges in your own setup? Because that's very new thing to you. There are many
Okay.
patients will come, and how do you maintain yourself and sustain yourself? Because creating your own self in your own setup with parallelly you're working on different setup, there are so many ideas will go on. So how do you cope up with those challenges?
So basically, when it's set up, I not only restrict myself to my living room, or I also do freelancing. So I give home visits. That's very important because, in acupuncture, if you go to see, there are many patients who are paralyzed, who are in severe back pain, shoulder pain, knee pain. You cannot expect everyone to come to you. I live at a third floor, and my building doesn't have a lift because it's a society, it's a complex kind of a thing. We have wings. So first of all, I cannot expect we have only 3 floors in one wing. So we have A, B, C, D, but I cannot expect the person or the patient who has osteoarthritis of knee joint to come to me, climbing 3 floors. That's not practically possible. That's what one challenge that I faced. But somehow Mumbai is well connected with local trains, with metros right now. To me, to reach even to Dahisar, that would take around 50 minutes earlier. Now I reach in 20 minutes without traffic, sitting in AC. So freelancing and home visits are must if you consider acupuncture as your this thing, because not always patients would want to come to you or would be able to come to you. Then you have to obviously decide your monetary this thing, that my traveling expense, the time that's taken, and you have to decide the whole stuff. But I think home visits are very important in a acupuncture field, cupping, exhibition, everything. Nutrition consultations, even I work overseas with NRIs and everything, that's perfectly fine. Even Westerners, nutrition can work online. Again, yoga therapy, I have patients who want in a outer, in outer distinct zones, they want it in park or beach. So you need to be open, and if you have some slots available, you have to give them that time. So my own thing doesn't mean that you have to restrict yourself always to a clinic or a setup. In nature cure, you might have, and home visits are good. You really get good connectivity there, because some people see that, okay, this doctor every day comes and visits this person for something. Then that person asks, okay, why are you calling a doctor? She'll share that, I'm having a back pain. So this doctor comes and treats, and it's really good. So even when you go out to places, Now, recently, I started 2, 3 clients teaching them in the park. So first I was a little reluctant to it, but as the days passed and I started taking these sessions in the park, people started noticing my work. People started noticing the energy I'm giving in my sessions, and many people got up to me like, okay, doctor, so you're a BNY, that's amazing. We would also want your sessions. How do we connect? How do we take a consultation from you and everything? So visiting places also, broadens your spectrum towards connectivity. So I think that's also very important. And that's one challenge I faced when you say that you have this place for people to come in nature cure, especially, that doesn't work. You have to give home visits. And as I said, I was very clear that I wanted to only do work on my 3 strengths: yoga, nutrition, and acupuncture. Decide what you're interested in, decide what's working with you. Because, don't be a master of all, like, this thing, jack of all and master of none. Sorry, jack of all and master of none. No, you need to work on your strengths. You need to understand what's the thing that's working with you and your nature. So I think that's very important.
So we would like to say thank you so much for these answers, because it means a lot for many students, because they look forward for these questions every day in themselves.
Right.
And yeah, so what would be your final message to all of us, to all the students who are going to listen to this?
My final message would be to please be consistent in your practices, because we are into yoga, nature cure, alternate medicine. We need to take care of ourselves first. You need to see to it that your posture is good, your skin is good, not through makeup and all. Obviously, that is a secondary thing. To groom yourself comes secondary, but internally grooming yourself, you should radiate that energy, radiate that positivity, so that people understand that, okay, this person is good at this. I want to be like this person. Like, if you go to a dentist who has all rotten teeth, how would you feel? Would you feel to get treated with them? No. The same way, if you say that you preach yoga, if you are teaching nature cure and nutrition consulting and acupuncture for this pain, that pain, posture correction, you have to be good at it. You should look energetic. You should radiate that energy to the person, right? So first, work on yourself, be consistent. Hard work is very important. Second, improve your communication skills, talk out, express, find opportunities where you can, spread the knowledge that you have, discuss with people, go around, introduce yourself. Networking, third is networking, very important. Stand out and keep updated. Stay updated. So these are 4 things that is very important in each and every student's life, especially people who are into alternative medicine.
Thank you, Dr. Shreya, to come on our platform, because it means a lot.
Thank you so
We
much.
have seen so many answers today, which gives a lot of insight towards how you build yourself. It's not we should depend on someone, because I have seen your graph, like how you are growing in field of your personal platform, which is Ojas Yoga, and at the same time you're working in one institute or one kind of corporate sector. So we can do multiple things as a BNYS doctors, and we should be proud to be called as a BNYS doctor, because we somewhere we miss out that link where we are. But your talk to me also and to many people are going to give so many insights. So with this approach, I would like to thank you once again to come on our platform, and thank you so much for reaching out.
Thank you so much, Dr. Bhavit. Thank you, Own Your Growth organization, for having me here today. Means a lot.
Okay, thank you so much.
Thank you. Thank you so much.